Welcome to the Practical Behavioral Care Podcast. Today, we're talking about anxiety, a broad umbrella that covers many experiences, from low-level worry to sudden, overwhelming panic. Understanding the different types of anxiety and the treatments that can help makes it easier to recognize what you're facing and take steps toward feeling better. Let's walk through some of the most common anxiety disorders, what they feel like, and how they're typically treated. Before we dive in, a quick disclaimer: this podcast is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a licensed healthcare provider for personal guidance regarding your mental health. Generalized Anxiety Disorder, GD. GD feels like persistent, uncontrollable worry about everyday life, even when there's no clear reason for alarm. It's that background anxiety that drains your energy and makes small decisions feel huge. Common symptoms include restlessness, trouble concentrating, muscle tension, fatigue, and imagining worst-case scenarios. Treatment usually combines cognitive behavioral therapy, lifestyle changes like sleep, exercise, and stress management, mindfulness practices, and sometimes medication. Small, consistent routines plus targeted therapy can make a big difference. Panic disorder shows up as sudden, intense attacks that seem to come out of nowhere, leaving you feeling shaken and out of control. Symptoms can include a racing heart, chest tightness, shortness of breath, and a strong fear of losing control or dying. Treatment often includes CBT, exposure-based techniques, grounding exercises, and sometimes medication. Learning to recognize early signs of an attack can reduce their intensity and frequency. Social anxiety disorder. This is a deep fear of social situations or being judged, where everyday interactions feel like high-stakes tests. People with social anxiety often fear embarrassment, avoid events, blush, shake, sweat, or overthink past conversations. CBT, exposure therapy, social skills training, and exercises to challenge negative self-beliefs are effective strategies. Specific phobias are intense fears of a particular object or situation, like heights, flying, needles, or spiders, often leading to avoidance that interferes with life. Immediate fear, panic, and distress when avoidance isn't possible are common. Gradual, safe exposure therapy is usually the most effective treatment. Obsessive-compulsive disorder, OCD. OCD often overlaps with anxiety. It involves intrusive, unwanted thoughts, obsessions that trigger repetitive behaviors or mental rituals, compulsions aimed at reducing anxiety. Symptoms include persistent intrusive thoughts, repetitive behaviors, and fear that something terrible will happen if rituals aren't performed. CBT with exposure and response prevention, ERP, and sometimes medication can help people face obsessions without performing compulsions. Post-traumatic stress disorder, PTSD. PTSD is closely related to anxiety and occurs after a traumatic event, leaving the body and mind on high alert long after the danger has passed. Symptoms include flashbacks, hypervigilance, avoidance of reminders, emotional numbness, and recurring nightmares. Trauma-focused therapies like EMDR, CBT adapted for trauma, and medication when needed can help process the trauma safely and rebuild a sense of safety. Closing thoughts: anxiety disorders aren't one-size-fits-all. Learning the differences can help you recognize what you're experiencing and choose the right strategies, therapy, lifestyle changes, or medication to get relief. If any of these descriptions resonate with you, reach out to a mental health professional or a trusted support person. Remember, here on the Practical Behavioral Care Podcast, our goal is to provide guidance, understanding, and practical tools to help you navigate your mental health journey. With the right support and strategies, meaningful change is possible.